in Our aim in this project, in this initiative, is to significantly decrease student debt and increase the number and diversity of exceptionally prepared graduates who work in community agencies on which our state's most vulnerable populations depend. So that's kind of the thrust of our program. We're in our partnerships, and let me first say that one of our key partners is the Behavioral Health Committee of HILT, and working with both Susie and Chelan. And, to be able to reach, a primary goal is to reach those who are in trained bachelor's degree employees, to introduce this program to them. They've committed already to community behavioral health, and we would like to support promotions and support your goals to stay in this field. So we're partnering with 13 universities across the state. Those universities, 13 universities and 20 programs. And that's because we're in some of the universities, we're in marriage and family therapy and social work or mental health counseling. So there's Antioch University, Central Washington University, Seattle University, Eastern Washington University, Gonzaga, Pacific Lutheran University, Seattle Pacific, Seattle U, University of Washington Tacoma, School of Social Work, Walla Walla University, Western Washington University, and Whitworth University. Currently, there are a couple programs where each year, and we've been in providing these programs over the last 2 years. And each year, a couple of the programs haven't had students, but they're actively engaged in the program. So what I'd like to do with you today is kind of give you an overview of the goals of the program, kind of talk about a conditional grant, what is required to get in the program, and to walk with you through our website to introduce you to the various sections that can give you additional information. It's also the portal that holds the application, so that if interested, you can apply to this program as you're applying to also one of the programs in our universities. So let's kind of go on. Got it. So again, here are our overall goals, and I'll just revisit those. Increase the number of well-trained master's level clinicians committed to working in community-based behavioral health agencies in Washington by 450 graduates. So we hope by 2026 that we have introduced to community behavioral health organizations throughout the state 450 graduates. Reduce the clinical staff turnover post-graduation rate, and create better alignment between graduate training and behavioral health workplace demands. Now, we're operating at the program level, but we're also operating at policy level, so that several agency directors have said to us, remarked, well, it's great to increase the number of employees coming into the organization, clinicians, but we want better conditions for them. We want higher level salaries for them. So we are doing work with our policymakers to change policies or to increase the amount of dollars that are going into community behavioral health. It's a very, I want to say, holistic approach to and commitment that's been demonstrated to community behavioral health. So the scholarship, students who have our conditional grants, meaning that a grant will be awarded, but it's based on a condition. And this condition is that grants are awarded to those who apply and get accepted by the universities. But after graduation, there's a 3-year commitment to working in a community behavioral health organization. So we're looking for students who have experience working in diverse communities, in underserved communities, diverse and underserved communities. Let me put, there's a maximum of $51,500 available to students that have been admitted into the program, and it's based on unmet financial need. So what does that mean? So it's the last dollar, meaning that you've applied to the program, you were offered 2 scholarships, and there's still a need. And so this particular grant, while it's $51,500, $25,000 a year, it may be that your need is only $18,000, and that's what you'll be granted. Training and working in WDI approved community health agencies. We have a list of about 200 agencies that are on our community behavioral health organizations that are on our approved list that offer comprehensive services to Medicaid clients. And so we have, and you'll see on the site, lists that you could review to see you might be a member of one of those organizations at the current time, or when you're looking at practicum experiences, you have to be at least 1 year in one of those identified organizations. And when you're ready to seek employment, to fulfill that 3-year requirement, it has to be done in one of the, we call it the green list organizations, but it's community behavioral health organizations here in King County and throughout the state. There's basic 6 strategies to this initiative. Reduce or eliminate student debt, and we've talked about that. Conduct targeted student recruitment. Create closer relationships between academia and employers. And one of the questions that comes up in this focus area is really getting academic programs talking with employers to see if the curriculum provides the basic knowledge, skills, and values to prepare an individual to come into the program and be into the agency and become successful. Where there are gaps, there's conversations going on as to how those gaps can be identified. Provide career support. We have learning forums that we work to co-create this experience where students identify areas that they would like for us to address and host a series of sessions with individuals, professionals that are in the field who come in and interact with our students on a monthly or bi-monthly basis. And students have found this very helpful. We also have resources on our portal, and our portal is just going to be launched at the end of this month, at the beginning of next week. So we're excited about that. But it's a host of opportunities that students can be available, and it's really a student portal. We're very committed to measuring the program's impact as we move through these 5 years, and we're interested in supporting better behavioral health policies that inform the kinds of resources that are directed to the community behavioral health agencies. So this is our purpose of career support. Guide students in assessing and improving their skills and knowledge with the support of professional mentors. Prepare for the first day on the job. Our Are we giving them a successful start in a comprehensive community behavioral health agency? And we have a couple assessment tools that support that work, and to help students identify steps toward achieving professional goals. We did a session on looking at how do you identify your strengths? And once identified, how do you expand upon where you are, but also how do you look at those skills that need to be developed, strengths that need to be developed, and what might be some of the paths that you take to do that? This is our WDI, the career support part of the website. And you can see the different sections. There's career resource tools, student assessments, where students looking at being a self-directed, how do they identify their strengths and areas for development? And then how do they tailor their learning plans to support this development? Through projects, course projects, through their practicum experience. They're very individualized. And I think each student has a unique profile. When I look at those of you who've worked in community behavioral health, you've already made a commitment to this field. You already know what the field is about. So I'm excited about students coming in and kind of really gauging, where am I? As we look at the job skills and knowledge and values that are requisites to being successful in this field. We're looking at mentorship opportunities and connecting students with mentors and probably mentorship groups. Our learning forum sessions are hosted on this site. So we record each session. If students aren't able to attend the sessions online through Zoom, they can go back later on and access that particular session through this portal. Job postings. In job postings, what we're doing is listing the agencies and the website, CBHAs and their websites, so students can go directly there to look to access job pages in job opportunities with each of the agencies to kind of support. They're looking for jobs in this last throughout the second year. We held a session last month is getting ready for the job search. And we had 4 practitioners to discuss hiring practices, to discuss how do you position yourself well for the interview, and how do you just simply send a letter or a note after that interview to say thank you for the opportunity. We have a social media. We actually have a group on Facebook that's just been launched so that students could stay in contact with one another. Let's see. These are the topics that we hosted this year. A career in community behavior health, and Susie, who's online with us from Sound, she offered that session for students, and it was very popular. Practicing cultural humility in community mental health care settings, boundaries and self-care, and the Strengths Finder workshop. Let's go to our website. I just wanted to kind of introduce you to it. And
just a reminder, Margaret, go ahead and do the stop screen share, and then you'll want to reshare since it's opening a new computer program. And also, you all are a very quiet group because it's probably the end of your day, but feel free to put questions in the chat anytime. And if you have any burning questions you'd like to voice, go ahead and use the raise hand feature. Great, we see that. You'll want to just go ahead and expand that screen.
There we go. So this is our website. Join the effort. This is the website you will complete an application, and I will go over just some of the features of it. So here you're talking about, we're just reviewing about the initiative. Tell us more. We want to provide you with more information about the initiative. 2 is how to apply to the program. Oops, there we go. And what's key, and I'll walk through, and I can't walk through deadlines because the deadlines are very specific to the university or school, but you apply to the graduate program of your choice, and maybe 2 or 3. And once you apply, you will also apply to the Ballmer Scholarship Grant Program, and it will direct, you will identify what schools you apply to, and it will direct your application to that school. But please note that schools will only review those applications if you've been accepted to the program. So once you've been accepted to the program, they will go to their portal of applications and review those applications. When you accept the offer to the school, accept their offer, they will go through those portals, review the applications, send them to be reviewed for a financial profile. And I guess I didn't say FAFSA. FAFSA, you might want to begin your FAFSA application and really look at when that, be very mindful of the deadline of FAFSA, because that's key to this process for them to identify the unmet need. So once you've completed that application has been completed and reviewed, the financial profile has been established, the school will notify you. And then you have that opportunity to be able to look at what that unmet need, and I was telling the group we had earlier that while we say 51,500, 25,000 per year, that unmet need, what we found in the last 2 years, that unmet need is it ranges between 18,000 and 25,000, with the majority of individuals being awarded the $25,000 for the first year, and the same for the second year. So just to let you know that students have been concerned about that, wondering, well, how much of that? Definitely not the full 50,000, but there's a range there that we've averaged. And I think students have been very pleased at the outcome of that process. So once you enter your first year of your graduate program, we will do an orientation around the Ballmer Scholarship Program and the requirements. So you'll be introduced to the website and the schedule that will follow over the year. You will have access to the career support portal and be able to look at the various opportunities that exist. And we will check in with you throughout the year. At the end of the 2 years, for some students, 1 year, for others, 18 months for some programs, we will actually bring you together for a very intentional closure process and begin to help you to understand how we will work with you over that 3-year period of time. I guess I want to stop and see if there are any questions based on what we've covered so far.
Yes, Margaret, there are some questions. So there's a question from David Jacobs, and I may need to ask for some clarification here, but he's asked if I've already been accepted, am I still able to apply?
Yes. If you've been accepted, you're starting your graduate program in September, yes, I would contact the liaison at your school. And I say the liaison for the Ballmer Scholarship Program, and see if they're still open to receiving applications, because each university has their own deadline. Oh, I thought you wanted to say something, Susie. So yes, please feel free to do that.
And I will link the scholarship application in the chat here.
Great.
Sorry, really quick, for University of Washington, who should I be contacting as the liaison? How should I get in contact with them?
I would contact the admissions department. They will direct you to Sophie. And I don't have Sophie's last name. I would have to look at my system, but Sophie is the coordinator for the Ballmer Scholarship Program. And she could let you know what the deadlines are. But they're always looking for students to be able to, access this opportunity.
Awesome. Thank you.
You're welcome.
There's another question in the chat from Darnell, and he's saying, has the fall deadline for the scholarship passed? And that's no. And hopefully you got that from the response from our last question. And then,
and let me say again, it depends on the school. It really depends. Like, we're open, but in terms of applying, if the student is going to start in the fall, that particular school will be able to let you know if they're still accepting applications and they haven't closed them.
Another thing to note, and Margaret, you'll probably get to this later in your presentation, but this will also continue in terms of the scholarship for the following year. So it's over a 2-year time frame.
Yes.
Yeah.
And go ahead.
Oh, there's a question from Christy in the chat. She was asking if people need to apply for FAFSA first. So I did say yes, but then she asked for clarification if they receive that unmet need funding after grants, but before federal student loans.
It is really, you can receive it after grants, but with federal student loans, we want to be able to prevent that from happening.
Okay.
So if when they actually give you, like, you may have work study on it, and you may have work study on your form, but they want to make sure that you're not going into debt through the student loan programs.
Great, thank you. Another question in here is, can I work full-time while I go to school part-time?
Yes, yes, you can. And again, I think it's going to be really important that you have a conversation with your human resource departments to look at what's required, because some organizations and agencies, they will really work with a student. I'm going to also ask Susie to talk about her experience, but they will work with you. You may want to decrease the number of hours that you're working in the agency so that you can go to school and then do your practicum experience in that agency. But when you complete practicum in that agency, you cannot, your job cannot be used as your practicum site. You would have to go to another department. And if there are a couple students there, you may exchange positions in order to fulfill the practicum requirements. But you really want to look at your school's policies in regards to doing your practicum in your place of employment. Susie, I wonder if you want to.
Yeah, so each school program, whether it's MSW or marriage family therapy, or whether it's mental health counseling, each program has their own internship requirements. You will be following what your program dictates. And then Those of you that are currently working in community behavioral health and you're going to school at the same time, I really encourage you to have really transparent conversations with your clinical supervisors, with your program managers, and as Margaret said, with your human resources folks, and find out what can the agency do to support you. Now, they don't have to do anything, but this scholarship program and the whole Washington workforce development is really to benefit the provider organizations so that we can serve the clients that are on our wait lists right now. We really need more behavioral health providers. So it benefits organizations to work with current employees who are in good standing. If you worked for me and I thought you were great, I would want to talk to you and figure out what would make the difference. And then, as Margaret started to say, we can give some examples. Now, each organization, your employer, has to make decisions based on the program and the services and where you're currently at. You know, somebody might make a request for me in my program that I can't approve because it's a small program and we don't have the coverage. However, if that person could work in a different program, then that supervisor might be able to be a little more accommodating. So it could get really complicated, but you won't know unless you ask, unless you have the conversation with your employers. Sometimes we had one person who was able to do half of her job, and the other half she got to practice as a therapist. And that was her internship. And then she finished, she graduated. Well, actually, she graduates like this month, and we're promoting her into a therapist position. So we supported her while she was in school, working full time and trying to go to school. We helped her accommodate that so that she could be at her internship as part of her work hours, made it feasible for her. And now we have somebody who's going to sign on for a 3-year commitment, who's a therapist. So your organizations can work with you on this. And, you know, the smaller organizations are going to have less wiggle room. So I can't make any promises for anybody. I can only tell you that most of the organizations in the Behavioral Health Committee are very eager to attract Ballmer scholars, to do your internships with them. And then they hope you like them well enough that you make your 3-year commitment with them. So, you know, it benefits both sides. So.
The other thing I wanted to address is that each program and how it's set up at the school is set up differently. And so if you're looking for a school schedule that's going to work with your existing work schedule, you're going to want to look at each individual school. And there's another question in the chat from Adrian asking, how does this work for 3-year programs?
For 3-year programs, you still only have to fulfill a 3-year work requirement, because most of the 3-year programs are part-time programs. So you still only have 3 years to fulfill after you graduate of employment in one of the identified agencies.
And the money is probably divided up by 3 years since you're a 3-year student instead of 2.
Yes.
There's another question from Tempest. I haven't applied to any schools. I just heard about this program. Do I need to start applying? Yes, you do. And it would not be for entry into the fall master's level programs, most likely because of deadlines that have passed. But again, this is over a 2-year time frame, goes until 2025. So now would be the time to be identifying schools and applying. And then at the same time, you can apply for the Ballmer scholarship. But again, the schools will not look at it until you have been accepted into their programs.
Many of the programs won't open their application portals, though, into the fall for the following year, for 2024. So, but the planning is so important, and a lot goes into the planning process. It's beginning just to talk with the schools, go to the admissions of the graduate program fairs, have the conversations with your departments, your supervisor, express your interest so that you are so poised by the time the portals open in the fall, you're ready to go. You have your plan mapped out and you begin to look at the FAFSA form. You may make some adjustments in your family life in order for you to go to school. So yeah, that's an exciting process, but planning is so key.
Margaret, do any of the schools take graduate students at the winter quarter?
I am not aware of any at the
Yeah,
winter
so-
quarter. Usually it's the fall of the year. And
Yeah.
again, there's the advanced standing program for social work, which is just a year. And in that in particular instance, the student only has to fulfill 2 years. So 1-year program, they only have to fulfill 2 years of employment.
There's a question from Cherry in the chat. She asked, what is the matching process like for the 3-year employment post-graduation? And is there flexibility as far as finding a mutually good fit? Does it have to be the same as your practicum?
I'll take
No,
that
it's-
one. Yeah,
Go
that
ahead.
absolutely. There's got to be a good fit. That's what employers want. That's what providers want. That's what all of you guys are going to want. So there are a lot of places to get jobs in King County. I think there's 22 community behavioral health organizations. So certainly if you land an internship that you just love the organization and the organization is satisfied with you, I call that a good fit. And I'd say sink your roots in there. If you're not happy with your internship, you just want something different, you want to try a different agency, you want to work with a different population, then you get your job in a different community behavioral health agency. If during the time you're working there, you want to take a different job at yet again another one, you can move. You have to work at community behavioral health as the condition of the money. That's so you don't pay the money back, you work for community behavioral health.
I think I heard the term matching. And that assumes that we match you with a job. And the employment is the student's responsibility. So hopefully you're staying at your agency for those 3 years, but there are various circumstances that occur. So if you're looking outside of your organization, you will be involved in that. It's just like a job search.
And I'd also add that these positions are in high demand. So there will be many organizations that are hiring master's level clinicians and seeking you out. There's another question here from Crystal. Are those currently attending eligible?
Are those currently attending a graduate program?
Yeah, I think so. And I think you addressed this a little bit, Margaret, in the last session, but I don't know if it matters kind of at what stage they're at, but I'll hand it over to you and we can ask for clarification if needed.
Right, it has to be the beginning of your program prior to your starting your graduate program. It doesn't happen, it can't occur midway. But yeah, unfortunately, it is at the beginning of the program.
So if you're a first year student now, you can't get into this for your second year, even if you're at a qualified agency and organization and school.
No, because it's a 2-year program because there's curriculum that is offered throughout the course of your program of study.
And I know, Margaret, you've talked about this before, but part of this investment from the Ballmer Group is to, provide this financial support, but also those wraparound supports to really train up a very successful cohort of individuals that have received this, because this really speaks to that proof of concept, right? That this is an investment that needs to be continued. And so they want people in for the full.
Right, all the
time.
supports that we've developed and all of the stuff behind it that Margaret went through in the website, All of that is part of the program, and
Mhm.
it allows you coaching and mentoring and additional information. And that, so you'll have people to reach out to throughout your education and your internship, and then during the 3 years that you're working. So it's a whole package. It's not just get the scholarship and you're on your own.
And a very flexible program of study as it relates to this particular program, meaning that if you can't attend the learning sessions, there's there are recordings in the portal that you can access, because we find that graduate students have just a variety of demands upon them as they're on their journey through the program. So we're trying to make it as flexible as possible, but trying to provide as much support as we can. And in each of the individual schools, they're also responsible for convening the Ballmer Scholars in their particular program, and they're offering support services. Okay, let me just point out a couple additional items on, let's see, where it says our partners. And again, I invite you to go, if you're, you have interest, to go to our portal, because you can, it will answer all of the questions that I think you need in order to look at applying and what is offered as you enter this program. When we talk about the green list and the community partners, you can find all 200 of them right on this website. These are our university partners. Here are the community partners. So we're setting up on the portal for career support all of these organizations with their websites that and most of those will direct you to their job listings, or at least you have their website so that you can go in and look at job openings. We also, let's see if we come back up. Here's the career support portal. There's career support, and you have to have, each student will be given a login, or there's a general login for all students and graduates that will get you into the portal. Frequently asked questions that will address some of the questions we've had tonight. But again, we'll address questions that have come up in orientation sessions and as students have journeyed through the program that might be helpful. And just in the news, there are several articles that have been written on the WDI initiative, and there are there's an opportunity to review them. So this is our portal. This is the place where you would apply for the program. And let me go through, I'll stop sharing and put back up the, yeah, that's not what I want to put back up. The presentation that's in the news.
There is one more question I could take while you're working on that,
There we
Margaret. Is that
go.
right? Oh, here, never mind then.
Oh no, please, let's take the question.
Okay, so there was one more question. Somebody's asking about the 3,000 hours of qualified supervised, the supervision that you need in order to get licensed. And I guess I really wanted to highlight this too. If you are a Ballmer Scholar and you get a job in community behavioral health after, many of us can also provide you the supervision you need while you're practicing to qualify to be licensed in the state of Washington. In order to be a supervisor, to do that, you have to meet certain qualifications. So not every supervisor is qualified. And of course, that supervisor has to match your discipline. So the social workers, MSWs out there will need an MSW supervisor, and like that. Licensed mental health will need LMHC to supervise them. So anyway, while you're working in those 3 years post-grad, inquire about getting supervision for licensure. It's very possible that during the time you're paying back your scholarship with your 3-year commitment, you can get your 3,000 hours and be ready to sit and be licensed. And we love it when you're licensed and still work at community behavioral health. So you may stay, you can get licensed before you leave, but it makes it really nice. Those of you that want to go on and get licensed, and I would encourage you all to do that. Really, the best way to do that is working in community behavioral health anyway. Otherwise, you're paying upwards of $150 an hour, $200 an hour for supervision.
Wow. Thank you, Susie. This is just a review again of the application process. Begin to check out the participating graduate programs and what they offer that uniquely reflects and responds to your needs. Look at the FAFSA and and look at the school's deadline for submitting that. Apply for admission to a qualifying master's program at a partnering institution. If you have already accepted admissions into your program, have already started your program, proceed to step 3. That is complete the online Ballmer Behavioral Health School Scholarship application and respond to that current deadline. The application takes approximately 60 minutes to complete and must be completed in 1 session. When the application period is open, the 18-month employment and application and 3-year employment application can be found at the top of this page. And that is the page that we had open on our website. Reply to a selection notification email by the acceptance deadline. So each of the schools have their own unique deadline. So if you're looking at 2 schools, UW, a School of Social Work, and maybe there's a mental health counseling program at UWT, each of those programs are unique, and you will want to look online at their admissions deadlines.
And don't forget to reply when they select you and offer.
Yes, yes. Let's see. Well, this is the Q&A, but we wanted to really give you a chance while I had the screen up or was covering a particular area to answer questions in the moment. And thank you, Shalane, for facilitating that for us. Oops. Oh, did I turn it? Did it go?
Oh, put it back. We want everybody to get a chance to take down your contact information if they need it.
Yes.
I'll also put that in the chat as
Oh,
well.
there you go.
If we
There you
just
go.
want to field the questions in this.
Okay, let's do that.
And if people have more particular questions around, I don't know, MSW versus MFT versus any of that, I'm available. If people want to reach out to me, you can email me or call me.
I want to say you have committed to the field of community behavioral health, and I just want to acknowledge each of you for doing the work in our communities to serve our populations. This gives you, if you're interested in the next level, new opportunities in your place of employment or just in the field, this is a wonderful opportunity to come back to school and to meet a group of people that are all, a cohort that are on that path with you. And what I see is such a wonderful social support system in this learning process. So contact those universities, look online. Begin to talk with your employer, because again, that takes time. They may have to create the opportunity, and it takes time to plan that and to look at opportunities that may not be there now, but with your expressed interest, it gives them a chance to huddle and look at how can we make this kind of opportunity work for our employee.
Yes.
The other thing I want to say is what an incredible opportunity this is. An investment this large in the field of behavioral health is something that has not happened. I don't know, Susie, you can tell me if it's happened.
Never.
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 So, you know, we really encourage all of you to get the word out with your friends, colleagues. So we really want to make sure that those who are already doing the work in the field and those that really want to find a way and are having trouble financially, that they have the information and can make these informed decisions, but know that there are resources out there.
Right. Somebody's asked another question. I commented about paying for qualified supervision. So after you graduate, when you're working during that 3 years, you want to get supervision towards your licensure if you can. If you get that at the place you're employed, let's say you're working at Sound and you're an MSW and you work in my program, I'm your supervisor, you automatically are going to get supervision over those 3 years that will be qualified, and then you can get a license. If you don't get supervision at your place of employment, and there are many reasons why you can't. For example, we only have so many MSWs. And so sometimes people work in a program that is overseen by somebody that's an LMHC. So they're not automatic, they're automatically getting weekly supervision, but that won't count for them for their degree, right? So it can be complicated. If you don't get supervision on the job, the other way to get it is the same as getting therapy from a private practitioner, is you contract with somebody who privately does qualified supervision for licensure. And that can cost anywhere from 100 to, I've seen 250 an hour for that. So, you know, I'm just saying there is in this opportunity, at least a way for most of you to get a good number of hours, if not your full number of hours to be licensed during 3 years. So it's a real bargain if that's another perk to a community behavioral health organization. So
Thank you
Well,
for answering that, Susie. I appreciate it. This
sure,
is Cher-
Sherry.
Thank you.
Thank you. Sure.
you know,
There's-
I was thinking about if you're working in a small agency and there's a limited number of graduate trained clinicians. Don't get discouraged, because again, the planning is so important. We are in the process of thinking through how can we identify roving field instructors
right.
for agencies that are small and have a limited number of individuals that can supervise you while in an internship or a practicum. So again, planning, reaching out, having your organization or agency contact the university to say, you know, we have students interested. How can we get additional resources to cover the supervision responsibility?
And for your employers, the Behavioral Health Committee, which is currently meeting monthly, is a resource. If you talk to supervisors who don't seem to think there's any way to be flexible, you could encourage them to come to the Behavioral Health Committee meetings and see if that's interesting to them, or reach out to me. Not everybody can do it. So again, I'm not speaking for organizations, but like Margaret just said, it's in the organization's best interest. If you're a good employee, they know if you're going to get your master's degree, they'd rather keep you on their staff than see you go somewhere else. So there's some energy to be creative here.
We have a hand up,
Mhm.
Ankila. Hope I'm saying that correctly.
Oops.
Close enough. I wanted to ask if I'm just now looking into this stuff after finding out about this scholarship, and I was wondering if it's possible to do the 1-year accelerated while full-time working.
The advanced standing,
Yeah, the advanced standing.
again, it would depend on your organization. Because you may be able to work out a flexible schedule, because you'll be doing practicum at that particular organization or agency, but in a different department. So I've seen some really creative strategies for responding to an individual student's need. So I would check it out with your agency personnel.
Right. I had a team member on my team who elected to do her internship somewhere else because she'd been working at Sound for 3 years already and she wanted a different experience. And so what she negotiated with me was to reduce her 40 hours to 30 hours. And then she was able to do a 20-hour-a-week internship. And so she was 50 hours a week, but that was doable for her. And we gave her 1 day off. So she was working a 4-day work week with us. And she took a little less salary for the time she was in her internship. But guess what? She's got her MSW now. So I don't know what her next step is going to be, but it all worked out. So see, and again, it's about, like Margaret keeps emphasizing, get in there, figure out which school, figure out what your heart sings to you. Do you want to be an MSW? Do you want to be a marriage, family, child? Do you want to be a licensed mental health counselor? Whichever degree it is, figure out which degree, apply to the school, apply to the program inside of that school, and get going. This is the second year, Margaret?
Yes.
Yeah, so there's already how many students out there that have graduated from this?
Well, we had a pilot program of 20 students.
That's
They
right.
graduated and they found jobs. It wasn't difficult at all to find employment in the field.
And I'm very excited. One of the jobs I do for Sound is I screen our interns. So I have a great time. I get to meet everybody who's interested. But I'm very excited too, because I have about 5 Ballmer scholars who have applied for internships. And believe me, as a supervisor bringing in interns, those are the ones I want. Because if we like you and you like us, there's a long-term commitment. And so everybody's hopeful about the opportunities in this.
And, in talking with the school academic programs, tell them about your individual circumstances and use them to help you think through. You don't have to do it alone. Think through how how they might put a program together for you that, again, responds to your individual needs.
Thank you for answering that so comprehensively. I really appreciate it.
Well, I just want to thank you. I know, Shalane, you'll take us out, but I just want to, again, thank you for being interested in coming out to hear about this program. I hope you find that it's something that can is appealing to you, and there's opportunity available to you if you choose this program. So thank you.
Thank
you all
you
for
all.
coming.
Absolutely. Contact information is in the chat for both Dr. Spearman and Susie, and we appreciate your time today.
Very good.
Thanks.
Thank you.